Today, couples trying to have children find out that they are dealing with infertility issues, but National Infertility Awareness Week starts today, and it's a movement that focuses on getting men and women some answers. And joining me now is Dr. Carol Kowalczyk from the Michigan Center for Fertility and Women's Health. We're so glad you're here this morning.
Thank you, Anu.
This is such a huge topic. I guess first of all, talk to us about how common is infertility for men and women?
It is very, very common. Currently, 1 in 8 couples trying to get pregnant are going to have problems with conceiving. And many times it is a male and female issue. 30% of the time it affects the men, and a majority of the time it's a couple's problem. So very, very common.
And where does this come from? I mean, is this age thing? I mean, how does this happen?
Many people think that it's the older couple that are having problems conceiving or trying to get pregnant, but it's all age ranges. Young patients in their 20s, several issues, problems with the male factor, with the sperm, problems with ovulation, structural issues. Women are older and trying to get pregnant, and many, many causes.
And as a fertility specialist, what do you tell people?
The first thing I tell them is that it is a medical condition, just like diabetes and heart disease, and this condition needs attention, and it deserves the proper evaluation and treatment. The second thing I say is there is so much hope out there when you're trying to get pregnant. In over 90% of cases, we can identify the problem, and most of those patients have the ability to be successful.
And talk to us about some of the options. I mean, are there new trends? I mean, things keep advancing every day.
First, when we do an evaluation, we base our treatment options and modalities on what the problem is. So a patient needs to undergo evaluations of hormones, sperm, and structure. Once we have that information, we can then offer them medical management to get them to ovulate more regularly. We can send them to a male fertility specialist to assess their sperm. They might require insemination or in vitro fertilization even. If there's structural issues with their tubes or their uterine cavity, we could treat those issues. New on the horizon are donor embryos, donor sperm, donor eggs for couples who are older trying to conceive. If there's a genetic condition, then we have the ability to identify those genetic conditions early before we put the embryos back in. And that has significantly reduced loss rates in women with recurrent miscarriage and improved fertility rates, especially for older couples.
Wow. And I know each case is different, but you have situations where things turn around quickly as well, right? In terms of actually being able to conceive, I mean, you have success that it happens faster than maybe anyone imagined.
Absolutely, and sometimes we still take credit when the patient's pregnant at the first visit on our door. We call it good karma, but absolutely. Patients can be pregnant as soon as we find an issue that we can treat easily, such as a problem with ovulation. But the main message to patients is to have hope, don't give up, and the journey can be long, but it definitely, there's light at the end of that tunnel.
And just one real quick question. Courtney on Facebook asked, how long after getting off of birth control should it take to get pregnant?
Great question. Many patients will say that they got pregnant a month after they've been off the pill. The relationship of birth control and getting pregnant is not significant. The underlying fertility cause is what needs to be evaluated first.
All right. Doctor, thank you so much for being here.
Welcome.
We appreciate it, and we'll have more details on our website, WXYZ.com. Just check the scene on 7 section. Malcolm?
Thanks, Anu.